Hello, my name is Saritz and I'm going to be your nurse for today. Can you tell me your name and date of birth?
Mary Smith, 21/21/21.
Alright, Mary, so today we're going to do some health teachings. I'm going to show you how to properly care for your JP drain, as well as drain and sign the symptoms that you want to tell your provider. Okay? Is it okay if I bring this chair over? Alright, so at the table here we have the supplies that you will need when you're doing this dressing change, as well as the graduated cylinder that you can take home with you to empty out the drain, okay? Get this ready. Alright, is it okay if I lift up your gown?
Mm-hmm.
Okay. So the first thing you want to do is assess the site, the drainage sponge, to note if there's any excess drainage coming out of your site or any foul smelling odors, okay? You can remove this. You can take a look at the dressing, same things, note any foul smelling odors, any color, okay? You can go ahead and trash this. The next thing you want to do is open up one of your 4x4 gauzes, making sure that you keep the inside clean, and you're going to wipe around the area, okay? And you're just going to take a look at the area, make sure there's not any redness, any warmth, anything to touch that may indicate infection, okay? You're going to grab a drainage sponge, keeping the inside clean, and you want to make sure that you place the tube in between here, okay? It's easier if you go under and then bring it above, okay? And then I have here the tape already pre-prepped, which will make it easier when you're doing this at home, okay?
Mm-hmm.
So you want to do one tape in each corner of the drainage sponge. And down below. Okay, so when that's all done, you can go ahead and lower your shirt. And then we're gonna go ahead and drain this, okay? So here we have the graduated cylinder. So what you wanna do is you wanna open this up. You want to grab your cylinder and you wanna pour this right into here. Okay, when you're at home, wherever this is most comfortable for you, you can place it, okay?
Mm-hmm.
So once you drain all the fluid that's in your JP, you wanna make sure that you collapse it, because this is how it works, and then you close it up, okay? And then when you're all done, you want to make sure that you place this in a dependent position so it's not tugging at your side, okay? And once that's all done, you want to assess the fluid. So you want to note the color, any odors that might you have, and the amount that you've drained in order to notify your provider of any abnormal findings, okay? And then once you're all done with that, you can dump it into the toilet and you can go ahead and flush it, okay? Do you feel okay to teach this back to me?
Mm-hmm.
Okay, whenever you're ready.
I'm going to take my tape out first. I'm going to bring this up. Let's take this dressing off. And I want to assess it. So I want to see if there are any abnormal colors, any abnormal smells, or drainages that come out of here that may indicate infection. So I'm done with that. I can throw that away. I'm going to grab one of these, clean off the site, keeping the bottom nice and clean. Throw that away. You can get rid of this. Next thing I'm going to do is I'm going to grab one of these
I'll mirror here if it's easier for you. And then when you're at home in your bathroom, you'll be able to use that one, okay?
I want to bring this piece of flat, and I want to tape this down. And one on the bottom to keep everything in place. Now I'm done with this, I can put down my shirt. I'm gonna grab this cylinder thing, I'm gonna put it here. I'm gonna open up the drainage device, pour it all into here. And before I close it, I wanna collapse, close, put it in the dependent position. This here, and then I want to measure it to make sure that there is no change in measurements. I want to see that there's no smelliness coming out of it, and I want to see the color that is before I can know if I have an infection or not.
Correct. Okay, do you have any other concerns or questions for me at the moment?
How did it look?
You did good. That was very good. And when you're at home, you can place all your supplies wherever you need them to make it more comfortable.
Okay.
Okay. All right, Mary. Thank you.